Hello, I'm sorry I can't be with you today, but I'm pleased to have this opportunity to contribute to your conference. I'm going to talk about children's services in the Highlands, and I'll focus on firstly our vision and plan for children's services, particularly the Highland Practice Model, our recent moves towards further integration of services, and also prevention and early intervention. Many of you will be familiar with the Highlands of Scotland. We cover around 1/3 of Scotland's landmass. Around 230,000 people live here, and that includes around 46,000 children. Around 4,300 of those children are entitled to free school meals, and many of them live in big urban areas like Inverness, but around a quarter of the population live in very remote and rural communities. Partner agencies in Highland first became committed to transformational change in children's services in the late 1990s. This is our latest Integrated Children's Services Plan. The first Integrated Children's Services Plan was published in 2001. We're about to publish our fourth. That very first plan had a vision that all of Highland's children have the best possible start in life, enjoy being young, and are supported to develop as confident, capable and resilient to fully maximise their potential. Since 2004, with For Highland's Children 2, we have also said that we want our children to be safe, healthy, achieving, nurtured, active, respected and responsible, and included. Those well-being indicators that we now refer to as SHANARI have in fact been adopted by the Scottish Government and included in the new Children and Young People's Bill. They've been incorporated into the Scottish Government's reform programme for children's services, called Getting It Right for Every Child, or often referred to just as GERFIC. These are the key elements of GERFIC. They have been embedded into the practice of all practitioners across Highland, be they social workers, teachers, nurses, police officers or third sector partners. It is the only way that we do business. Firstly, the practice model describes a pathway through services, with clarity about the role of each practitioner and clarity about the join points between them. Integrated services is not about a teacher becoming a social worker. It's about having a good teacher and a good social worker who are clear about their roles, but also the join points. That is based around a common language and also practice that empowers children and families. We have a named person and lead professional roles, and I'll talk about that a bit more later. We have a single assessment framework that builds from birth that all practitioners use, and that assessment determines a single child's plan, and that single child's plan determines the service that is provided, with less bureaucracy, fewer meetings and more contact between practitioners and children. The practice model is based on a number of concepts, and some of them, like this one, will be familiar to you. The child is always at the centre of our concerns, and it's the child we focus on, but we can never forget that it's the family who are the main developers, nurturers, educators, health givers of that child, and we have to support families to support children. But families live in communities, and communities require sustainable services to support families, to support children. Accordingly, Scotland's assessment framework has got 3 dimensions, and you can see those around the 3 sides of this triangle. Firstly, the child's own development. Secondly, the capacity of the family to support the child. And then thirdly, the capacity of the local community to support the family. The pathway sets out the roles of each practitioner within their service, and it emphasises the role of the health service as the key service in the early years of life, with that baton being handed over when children move into primary school and the education service takes that responsibility. So the model is a tiered model that looks like this. All children are in universal services and they receive the core programme or the core curriculum throughout their early years and their school years. And throughout that time they have a named person who oversees their welfare and their well-being, and if they need additional support, that named person identifies the elements of support that are required from the universal service. If the named person requires additional support from other services, they become a lead professional coordinating that support, which hopefully is short-term, timeous and effective. If the support is required for longer, or if the support becomes more complex, then the lead professional would come from another agency. Normally it would become a social worker. But it's a continuum, and children can move quickly and easily without bureaucracy into higher level services and also back into universal services. It should be inclusive for all children. And every child will continue to have a named person, albeit on occasion some children will also have a lead professional who coordinates what has become a multi-agency plan. The development of the Highland Practice Model took place between 2006 and 2008, and it was fully implemented across the authority in 2010. That involved extensive change management across all local agencies, supported by a dedicated change team and with some new posts and new structures. Critically, the posts that we created, which utilised new government funding, provided additional social care capacity to support universal services, recognising that early intervention has to be focused around work in the early years and around schools. The practice model has consolidated joint working. But in 2010, local agencies determined that we should move from joint working to further integrated services with single management, single governance and a single budget. In 2012, we joined child health and children's social care within the council, and in April of this year, we joined education to create a care and learning service within the council that supports children from the earliest days as we take over responsibilities from midwives right through to adulthood. That organisational integration will provide the opportunity for further integration of frontline services. An example of that is the coming together of health and social care teams into single frontline integrated teams, which will happen in October of this year. Those family teams will also provide enhanced capacity to support children in the early years. Having seen the benefits of early intervention and having been influenced by inspirational figures such as Bruce Perry, the local authority has recognised the value of additional investment in the early years and has committed an additional £2 million to new posts that will come into place in October with the family teams. This funding has come from across all council budgets and has the support of all council directors. They get it. Of course, none of this is of any value unless it makes a difference. But we've had a number of evaluations now which suggest that it is making a significant difference. Improved processes with less bureaucracy have led to better assessments and earlier provision of services. Families say they like the new approach. They say they know what is intended and they know what will happen. That is leading to improved outcomes for children and for families. Higher levels of early intervention with more children, also leading to fewer looked after children, fewer children who are offending, and fewer children on the Child Protection Register. Also some quite significant figures around substance misuse, smoking and other public health indicators. across the board a range of improved outcomes. And very recently, we received the report of the inspection of our children's services that took place over 5 weeks in late 2013. And it provided reaffirmation of the difference we are making and about those improved outcomes for children and families, with a range of very good grades. We are not complacent, and we continue to strive to improve the practice model. But we believe that the practice model is already helping to keep Highlands children safe, healthy, achieving, nurtured, active, respected and responsible and included. Thank you for inviting me to contribute to your conference.